Hi everyone and welcome to the Year 10 exam review. The purpose of this video is to go through the exam questions from your Year 10 exam and to help you to understand exactly where you dropped marks so that in the future you can improve your marks, you can improve your exam technique. Okay, so while you're going through the video, feel free to skip through any sections where you're really happy with the answer you gave, where you know you got full marks, and really focus on the areas that you need to improve on. Here goes. Okay, so the first questions we're going to have a look at are the multiple choice questions. And as you can see from this picture, the dots represent how many people got each of those questions wrong. So there's certain questions like number 9, number 8, that a lot of people were incorrect on. A few questions, not so many people, only one question that nobody got wrong. So we're going to break down on the next few slides, break down each question one by one. Okay, so question 1. This is one of those questions that tries to catch you out with the use of the word not. Okay, don't be fooled by that. Read the question carefully to make sure that you understand exactly what it's asking. So the question is asking which of the following is not an example of an externally caused injury. I've provided here the definition of the externally caused injury. You should know that. So using that definition, we should be able to rule out some of the answers on the list. So if an externally caused injury is to do with interaction with another person or another object, then impact can be ruled out straight away. Foul play, so a bad tackle or an illegal move, can rule that one out as well. Anything to do with equipment that is an external object, we can rule that out. That only leaves us with one, overuse injury. Okay, so hopefully anyway you knew overuse injury is an injury that occurs over a long period of time, often to do with repetitive actions. Not too much to say about question 2. Every single person got it correct. Lactic acid built up as a result of fatigue. Well done. Another question that was answered very well, question number 3. Which of the following tests would be appropriate to measure power? So power is a combination of speed and strength, and jumping is a really good example of an activity involving large amounts of power. So that should point you towards the standing broad jump or standing long jump as the test for power. Question 4, another one answered well by most people. This one, you've just got to learn it. 220 minus your age, that's how you work out your maximum heart rate. So yours would be about 205, maybe 206. This question caught a few people out. It's those two words again that can sometimes be confusing, sprain and strain. So the way to remember, if you're not sure which one's which, the T in strain means we're talking about a muscle. So if you remember T for triceps. Okay, this question is talking about a ligament, not a muscle, so it must be the other one. So it must be the sprain. So sprain is the correct answer, B. Okay, question 6. Which of these is not a function of the circulatory system? So the circulatory system, we're talking about the blood vessels. So A, B and C, we can see there that all three of those are talking about things that the blood does as it moves around the body. Digestion, the only one that doesn't. Digestion occurs in a different part of the body, in the stomach and the intestines. So digestion is the odd one out there. Question number 7 includes some equations. These often catch people out. Make sure you read these questions carefully. This question is talking about the equation for anaerobic respiration. So anaerobic, straight away we should be thinking about how that means we've got a lack of oxygen. So a lack of oxygen, that means we can get rid of A, we can get rid of B. Both those equations involve oxygen, so they can't be the answer. So then we're left with 2 equations, okay? And we should know that lactic acid is a product of respiration. It's not there at the beginning, it's a product at the end here. Okay, so we can cross out D and come up with our answer of C. Glucose leads to energy and lactic acid as a byproduct. Question 8, this one might have caught you out. Isotonic is a word that we associate with muscles, but more with muscle contractions. So isotonic is a type of muscle contraction rather than an actual type of muscle. So we're looking at isotonic as the answer. If you were doing a process of elimination, cardiac muscle, that's the heart. We can cross that one out. That is a type of muscle. Involuntary muscle, things like the diaphragm that help us to breathe. We don't have to consciously control that. Skeletal muscle, these are the muscles like the biceps, triceps, quadriceps, the main muscles in the body that help us to move. So we're left with our answer of isotonic. Question 9 was the multiple choice question that caught the most people out. A lot of people put patella as their answer or tarsals as their answer. So the actual answer is skull. Skull is the only bone on the list that is not an irregular bone. The skull is actually a flat bone, so it's got a big surface area for attachment of muscles. The other 3 on the list are irregular bones. Here's that overuse injury coming up again. As mentioned earlier, an overuse injury is an injury that occurs over a long period of time as a result of repetitive actions. So if we look at that list there, hamstring pull could be caused, for example, stretching for a ball in football. That's a sudden injury. It happens straight away, it's immediate. Twisted knee, perhaps changing direction when playing tennis. Again, it's a sudden injury. It happens immediately. A fractured wrist, perhaps falling from a bike and landing, putting your hands down and landing and fracturing your wrist. All those 3 happen immediately. They're sudden injuries. Tennis elbow, though, is caused by repetitive actions, swinging the arm over and over again in the same way that causes this injury over a long period of time. Okay, so moving away from the multiple choice questions now onto the shorter answer questions. And the first one of those, question number 11, asks you to explain the difference between isometric and isotonic muscular contractions. Quite a few people missed out marks on this one. So the top answer here, I've provided a couple of examples that people gave. The top answer achieves full marks, 2 out of 2, simply by saying that isotonic is to do with movement, so the muscles either lengthen or shorten, and then the isometric doesn't. So the muscles are not getting longer or shorter. The second example that I've provided, the reason why I've put this one in, it just shows a little bit of extra depth by including some examples of sporting actions that could be examples of those muscular contractions. So looking here at the mark scheme for that question, the things that were mentioned in the answer that I've shown you are talking about no movement or talking about movement. And as this is only a 2-mark question, that's all you really needed to do. If the question was asking for more marks, I would expect you to include more information. So about what happens to the muscles, do they lengthen, do they shorten? About stabilising the joint, I'd expect you to give examples. Right, moving on, question 12. This one's about joints. So the question is asking here for types of joints, not names of joints, the first part of the question, part A. Unfortunately, quite a few people wrote down names of joints in the section A of this question, so they might have written knee, shoulder, elbow. Okay, that part of the question was asking for types of joints. So I would have expected, and this is what happened, a lot of people identified the hinge joint and the ball and socket. They're the 2 most obvious ones. Once you've done that part of the question, part B then asks you for an example of where each one of those might be located in the body. So we're looking there for hinge, elbow and knee, ball and socket, hip and shoulder. Okay, if you are currently not aware of those 2 types of joints and where they might be found, then that is something you really need to learn. Those are the 2 main joints in the body, the main types of joints, and those 2 are the ones that you are most likely to be asked about on an exam. Right, question number 13. This one was answered pretty poorly actually by most people. A lot of people picked up 1 mark. That 1 mark was generally for this point here about attaching bone to bone. A lot of people did that, so well done. Some people incorrectly put that it attaches bone to muscle. That's actually tendons that do that. So make sure you're clear on the difference between ligaments and tendons. The point that most people missed out on was either what they're made of, so bands of fibre, or the fact that they are to do with stability in the joint. So they help to keep all the parts of the joint together so that nothing moves out of place. They're not so much to do with creating movement. That's the muscles and tendons that work together to do that. Okay, here we have question 14. This one's just a simple labelling question. A lot of people dropped marks again on this question, either by getting things the wrong way round or for using the incorrect terminology. So this person achieved 4 marks. They've unfortunately spelt a couple of words wrong, but in this question that doesn't matter as long as it's clear what it is that you mean. So be careful of your spelling. Pharynx, we're looking for a PH and a Y. Okay, notice here the person has put throat first of all. Just putting throat would only, on this paper, have got you half a mark. We're looking for the technical terminology. So pharynx is the proper name, the scientific name for the throat, and pharynx would have gained a full mark. So further down, trachea is the name for the windpipe. Again, windpipe would have achieved only half a mark, trachea a full mark. So be careful with those technical terms. Bronchioles further down, the bronchus or the bronchi split into bronchioles. So we've got bronchi here splitting into the smaller bronchioles, the branches coming off. Okay, this one over here, diaphragm, quite a few people didn't get that one, something we possibly haven't specifically mentioned in lessons. The diaphragm is the name of this muscle here underneath that aids breathing. It helps to make the lungs expand and get smaller again so that air can come in and move out again. So it's important that you're aware of the names of these structural parts of the respiratory system so that you know what happens when air comes in and when air goes out of your body. Right, question 14b, a nice easy 2 marks here, and a lot of people put pretty much perfect responses to this question. So gaseous exchange, we're talking about what is it and where does it occur in the body. So the first mark, all you had to mention was the exchange between oxygen and carbon dioxide. That is gaseous exchange. And to get the second mark, that it takes place in the alveoli. If you said it takes place in the lungs, it does, but it's not quite specific enough. Only half a mark for lungs. So again, you've got to make sure you're always using that technical terminology to make sure you pick up as many marks as possible. Right, question 15. This is where things start to become a little bit more difficult and involve a little bit more thought and linking different things together. So the first part of the question asks you about the physical effects of stress. Note that the word physical is in bold print. Always pay close attention to the words in bold print. Always read the question properly. So physical effects of stress. Some people talked about mental effects of stress, psychological effects. You wouldn't have picked up marks for those. So here this person has correctly identified 2 physical effects. So technique worsening, this first point here, picked up a mark there for mentioning that. Feeling sick, a physical effect. Okay, another one that could have been mentioned is to do with tightness in the muscles, another physical effect. Okay, then moving down into part B, it says for each of these physical effects, explain how they could affect an athlete's performance. Keyword there, performance. So what impact is that going to have on the way they take part, on whether they achieve, whether they win, whether they score, whether they achieve a good time. So this person here has talked about the technique, meaning that they might end up getting injured if they're using a poor technique, which obviously then gives the opposition an advantage. So that's a very good point, talking about injury. The second point they've made, feeling sick, and they've talked about that potentially that person may have to be removed from the competition altogether, which means that they won't be able to carry on taking part. Okay, so clearly there they've talked about how performance is affected.